All right, thank you very much for joining us at this early hour. We do appreciate it, and we apologize for the hour. However, as you all will have noticed, this is a very busy week, and this was the time slot that we were able to procure for this event. So let me introduce myself. My name is Dean Chambliss. I'm the head of Country and Sub-Regional Cooperation here in PAHO, and I'll be helping to speed the discussion along this morning, especially in view, again, of the time that we do have available. At this time, this event, again, has been convened by our colleagues from Panama, and I would like to hand over to Dr. Miguel Antonio Mayo de Bello, the Minister of Health from the Panamanian government. So, Señor Minister.
Gracias, Dean. Muy buenos días.
Thank you, Dean. Good morning, Madam Director of the Pan American Health Organization and distinguished ministers, vice ministers, and heads of delegations of the countries of the Americas, dear colleagues and friends who work to develop the health of the Americas. I'd like to thank you for attending this special event where we hope that together we will place health at the center of the sustainable development of our peoples. With the assistance of the Ministry of Health of Panama and the support of PAHO as the secretariat for this process, the ministers and secretaries of health of the Americas who met in Panama on the 3rd of June 2007 subscribed to a historic declaration under the framework of the launching of the Agenda for the Americas Health 2017, with intersectoral action and the role of the social determinants of health in formulating public health, and with a dialogue and joint action amongst all stakeholders of society in order to promote and move forward in attaining our regional goal objectives. B, it was to urge all government, civil society, and the international community to consider this agenda as a guide for inspiring and developing public policies and for executing actions on behalf of health and the well-being of the populations of Americas. In the agenda, after an analysis of the situation and health trends in the Americas, we agreed to 8 important areas of action that would be addressed following principles and values. 1, human rights, universality, solidarity, Pan-American solidarity, health equity, and social involvement. The preliminary report of the mid-year review of the agenda undertaken by the Ministry of Health of Argentina was presented at the 28th Pan American Sanitary Conference in September of 2012. And the report concludes that the agenda was used by a significant number of countries to help them draft their national plans and health policies and strategies. And it was used by other international organizations as well. It was agreed that there was significant progress made in all areas of action, although there were some areas identified as less progressive, such as those that had to do with maternal mortality, dengue, and mortality, amongst other diseases and health status. It also talked about the stagnation of public health as a percentage of GDP in a country and the limited expense on health. The report also analyzes the contribution the office has made to the agenda and to the success, and states that there's a need to have a system of indicators to improve analysis. Within the context of the 2030 Agenda for the Sustainable Development Goals that was approved by our states on the 25th of September in 2015, we now need to draft the next agenda for the Americas Health and link it to the Sustainable Development Goals. We need to continue this effort with the support of Pan American Health Organization. In the material that has been given to you for this event, you have a proposal document and a roadmap of the new agenda that we are proposing to be discussed. And in a moment, we'll present summary of it, and I'd like to invite you to work together with us to develop this new sustainable roadmap for health and make it a sustainable agenda so that health focuses on the individual and provides health with equity.
For those opening remarks. At this time, I would like to ask our director, Dr. Carissa Etienne, to welcome you.
Thank you, Mr. Chambliss. Honorable ministers, vice ministers, heads of delegation. Let me begin by thanking Panama for continuing their role of leadership in terms of the health agenda of the Americas. Probably Mr. Chambliss and I are the only persons who were around in this position when the first health agenda in the Americas was done. And Panama led that group. And no offense to you, Mr. Minister, but at that time we had a minister that was bigger than life, no? And he drove the process. And I think a lot of his energy also transmitted itself to the other member states. And therefore we had this agenda. So first I want to thank Panama for the work that they did and the continuing vigilance in terms of, yes, let's move to see, can we do another agenda? I also want to thank Argentina because they coordinated the work in terms of the midterm review of the health agenda in the Americas. And sometimes countries may ask, why do we need a health agenda in the Americas? We have a strategic plan for PAHO strategic plan. We have our national plans. Why do we still need a health agenda? The health agenda is the policy document of the ministers of health. Not the ministers of health working with the PAHO secretariat in the PAHO context. It is a policy document, a joint document of the ministers and ministries of health of the region that will guide participation, relationships across the region. It is not the Secretariat's document. It is yours. And I think we want to stress this. However, the Secretariat performs its role as support as Secretariat. We give maximum support, but not in a leadership role. I really want to stress this. In fact, I was thinking that after I say my thank you, I should join the floor and not sit at the table, because our role is one of support. Maximum support we will give to you, but I want to reiterate that it is a member state-driven process, and what has been suggested for the health agenda for 2018, 2030 is around the whole concept of sustainable health of the sustainable health agenda. This is an agenda that is going to dominate all of what we do until 2030. I think this region has done well in terms of the achievements under the Millennium Development Goals, and we must take that with the commensurate vigor and commitment as we look forward to the 2030 agenda. And as you know, the 2030 agenda that looks to leaving no one behind, but certainly that looks to how can we confront poverty together, poverty eradication. How can we together ensure that our planet remains safe? How can we put people at the very center of development? And how can we build those partnerships that will allow us to get to a 2030 where people are much better off, when no one is left behind? And for us in health, the SDG 3 is important. But as you ministers have and ministries, as you probably have already recognized, building partnerships is going to be extremely important, because the social determinants of health impinge so much on the health status and what we can achieve in health. And so building those partnerships in an all of government approach, but the partnerships with other sectors, the private sector, civil society, and people themselves, because very often we leave the people out of the picture. We do unto them, but we are not doing with them. And how do we place them in the center? So I believe, and I would recommend to you that the theme Sustainable Health Agenda of the Americas is a good one, given the context within which we must do our work. I just want to say that this is an opportunity for us. It's not too far from the launching of Sustainable Development Agenda. This is an opportunity for you, ministers of health, to deliberate on how you see the major priorities in the Sustainable Development Agenda as it pertains to health, where it is that you see the big picture, the big priorities that you would want to work with all of your partners around and with all of your fellow governments. So I want to urge you that this is important. I hope you think so. And I want to, again, commit the staff and the support of the organization to help you accomplish this goal, if that is your goal, and to say that we will give you all of the support necessary. The chair, the vice chair, or whoever the working group is, we will accompany you on the way, but never in a leadership position. Always in a supportive stance. So thank you again for coming, and thank you. Thank you again, Panama Minister. Thank you.
Thank you very much, excuse me, Madam Director. At this time, I would like to hand over to Dr. Reina Roa, the Director of Planning in the Ministry of Health of Panama, for a presentation. Thank you.
Sí, muy buenos días.
Good morning. I'd like to share with you some ideas on what this whole process means and what we, the countries, should support from a technical perspective in order to make this a relevant process. I will begin by discussing the framework for strategic planning that we have developed within the Pan American Health Organization. I'll give you some background, the purpose of this agenda, and talk about some ideas on how we could start this process to develop a new collective agenda agreed to by consensus. If you look back between 1990 and 2015, we worked on the MDGs, and our commitment today in all states is to work on the Sustainable Development Goals that have very clear goals which we are supposed to attain between 2015 and 2030. So we also see the context of the strategic plan we've been developing, and which we had within the framework of WHO for 2008-2013, and the general program of work of the WHO, to which we have made a commitment between 2014-2019. Following that, you have the Agenda of Health for the Americas, which is in force until 2017. So the question now is, how are we going to draft a new health agenda for the Americas that will be valid until 2030? And here you can see that we've had a strategic planning process of the World Health Organization that in the first stage was 2003, 2007. There was changes and adjustments made given the context for the period 2008, 2013. And so the current strategic plan, which expires in 2019, and which we need to develop now a new plan, taking into account the new health agenda for the Americas and extended up until 2025. The cooperation strategies have focused on all these processes, and the countries and the Secretariat of PAHO have been working in a coordinated fashion to develop these. And we've also developed biannual program budgets. We're working on one right now, the one that is valid until 2017, and it is up to this assembly to start working on the plan for 2018-2019. So this gives you the global perspective, the global view of our policies, our strategies, and our national as well as regional plans that guide our work in the area of regional health. When you look at the process, the change process that we're seeking to achieve at the global level, we must keep in mind that we have taken on the commitments of the Sustainable Development Goals, which, as the director said, includes things such as avoiding falling back, establishing equality, changing health, ensuring that people have access, and that we have peace and prosperity. So our agenda, therefore, has to fit in with that vision, and it should guide our country's actions as a regional group that we are, and take into account multisectoral elements that help us attain that commitment established by the Sustainable Development Goals. When you look at the background, the track record, what should we conceive of this agenda for this agenda? First of all, it's a policy document. It allows us to make a commitment based on a shared and consensual vision. And it has a regional focus, and it also needs to complement as well as respond to the mandates that this organization itself has established for itself, as well as the health objectives that we have committed to carrying out through global entities, through the World Health Assembly, and where we have agreed to incorporate those in our own regional processes. This agenda also should serve as a source of guidance, of orientation for any plans that we develop at the regional level or at the national level, so that we can focus on ensuring that we have healthier countries, more equitable countries, and so that we can start to work on the health determinants, which have an impact on our population, and where we must acknowledge that we cannot do this unless we commit to working on a collective multisectoral basis to attain this. Of course, always with the focus that we need to improve access to high-quality health services, because right now we have a quality in the area of quality of services, a crisis in the area of quality of services and collective health. This new agenda, well, why do we call it a new agenda? Well, all of us have said we have a lot of commitments, we have a lot of strategic plans, SDGs, and a whole series of new global political frameworks within which we must operate. Well, as a region, as an organization, we need to analyze this new context and therefore take on those commitments that we have been making in the area of global health and with our populations in general. So to attain that, it is important that we have a policy document for our region that explicitly lays out how we are going to address these issues, how we're going to develop a regional response to help us attain the Sustainable Development Goals. So it goes beyond just attaining Objective 3, which is the one that deals with specific health matters. Because as I said earlier, in the area of determinants, whenever you analyze the different methodologies within the context of the 17 SDGs, we can find that many of them are actually linked to health. So we have to look at the collective picture and see which ones of those targets needs to be addressed from a regional perspective, even though they are not included in the specific health SDG. So the agenda is therefore an opportunity for the ministers of health in our countries and for the member states of the organization to look at the health situation and develop a collective multi-sectoral action to ensure that we have sustainable development, and incorporating not only government agencies but also involving civil society and the population itself as part of that right they have to health and the duties that the governments have to provide health to all citizens. The effective implementation of SDGs means that we as a region and as countries per se need to very clearly define those goals and those indicators that we need to follow.
The SDGs themselves provide a range of indicators which, as we know, and this is what differentiates them from the Millennium Development Goals, can be adjusted and made in accordance to the context of a country and even of the region. So there is work ahead of us that allow us to move these decisions and to transfer them to the agenda. A roadmap or a proposal for it means that we have to clearly understand that this is not a secretariat process, but rather a process that member states have to really manage and take ownership of. Quite clearly, it's going to be a collective process, one that will require political consensus. It will need time and effort by us, the ministers, and the technical teams of the Ministries of Health. It will be framed in seeking to optimize the planning processes that are underway. And that is because the current agenda has already had a midterm evaluation, and it needs to be evaluated at the end of the process. But there are yet other strategies that are currently evaluating the health indicators. As one example, the health of the Americas. And we'd have to coordinate all the results, and that way we'll be in a position to build a new agenda for health of the Americas that will be responsive to the situations encountered having to do with health issues as well as diseases that appear throughout the process. As in the previous occasion, the idea this time is again to create a working group. And this group should comprise 8 to 10 countries that can be representative of the entire region: North American, Caribbean, Central America, and South America. It should have a chairperson and a vice chair, and we suggest that they be selected from the group of countries that on a voluntary basis decide to join the process and the leadership in this process for building the new agenda of health for the Americas. We have asked the PAHO Secretariat to, as usual, provide us with technical support and the logistics required to tackle the issue. We also believe that there are two work modalities that can be employed. One of them will be focused on virtual work and interaction, and the other is to have some face-to-face meetings, perhaps in the framework of the different meetings that are arranged for the directing bodies of PAHO. Lastly, we've thought about establishing a flexible calendar covering at least from October 2016 to September 2017. But what we want to achieve with this is to place the issue before you now, open the discussion, and hear your inputs. First, we'd like to know if you really believe it is necessary for us to build a new health agenda for the Americas, and second, the mechanisms and also who volunteers to join this group of 8 to 10 countries to work on this vision. So that's what I wanted to share with you this morning, and I would like to express my gratitude for your presence here today. We do apologize for the time. It's been very, very early, plus on a rainy day, or a day that potentially will be rainy, but I think this demonstrates that we truly feel we have a commitment towards the health of the Americas. Thank you.
Thank you very much, Dr. Reina. At this time, we will open up the floor for discussion. I would just like to say, following on from the remarks that the director made at the beginning, there are a few of us in this room, I think both in the Secretariat side as well as the member state side, who did accompany and, in the case of the Secretariat, support the previous process for the development of the health agenda in the period 2006 to 2007. And we are, of course, available to answer any questions that you might have about that process as well. So at this time, I'd like to open up the floor.
Okay, so I guess I start. Good morning, everyone. Thank you very much for this proposal. Actually, from the United States, we are extremely interested and supportive of the concept of developing the Sustainable Health Agenda for the Americas for the next period. We really like the idea that this is really linked to the Sustainable Development Goals. We like the fact that we really need that regional approach, leveraging on the strength, cooperation, and success that the region already has shown. We really like the fact that this is member-driven as well and inclusive, as you had proposed before. Reducing inequities for the United States is a big challenge. As you know, even though we do have the Affordable Care Act, we still have tremendous challenges on reaching out to many of our disadvantaged populations that live in rural areas, as well as our ethnic and racial minorities. So we really welcome a lot that focus as well. As reading the document, we really appreciate the focus on data and analysis and utilization of technology and new platforms, something that the United States have been very actively working on integration of those, as well as the sustainable interventions based on evidence. Using the holistic approach on how the regional and national and sub-regional priorities are linked and are part of a whole is extremely important. And finally, the United States will be happy and honored to be part of that working group, to share experiences as well as technical expertise, and to pull from some of our HHS components that will be able to participate and contribute to the discussion. Thank you.
Thank you very much, United States. I see Barbados would like to speak.
Good morning, and thank you for having this meeting. And let me thank the Minister of Panama and the support team in Panama for the leadership they have given to this particular process. We believe in Barbados that this is a very important agenda item, and we want to signal our intention to participate in this working group to the extent that we are able. Already in terms of our approach to health and well-being and wellness of the population of Barbados, we have developed and are developing, along with the Ministry of Social Care, what we refer to in Barbados as the IC Bridge approach. that sort of focuses on 3 specific areas of identification of critical interventions that may be required with a particular group or family. The stabilization of that situation vis-a-vis not only health, as we say, but in all aspects of that family situation. Eventual enablement of the persons involved so that they begin to be able to work for themselves and provide that critical help to their situation, so as to relieve the government and the ministry of the burden necessarily of continuing that process, and of course empowerment, eventual empowerment, when that family or that identified group can move on their own then and become real contributors in our society. This helps us, of course, in the entire battle to deal with minority groups in our communities who are always the source of so many problems that can be developed. And empowering and providing that helping hand is critical. Of course, we want to take note, too, of the very important fact of the participation of the private sector in this engagement. It is absolutely critical, and certainly we have had a high level of contribution from the private sector in Barbados to our health and social care programs. In the case of our Queen Elizabeth Hospital, for instance, we, along with our own flag bearer, Rihanna, who has more or less led the process, there are a number of other private sector agencies, especially focusing on our tourism business sector, who have joined us in strengthening our health programs. And we are certainly grateful to them, and we intend to provide all the facilitation we can to make this happen. So yes, we think this is a very important step in the region, especially in regarding the new approach to the Sustainable Development Goals and the attainment of this objective by 2030. So Barbados stands ready to participate in this program. I look forward to be able to learn from some of the examples that are already out there, and certainly to help those who may need some assistance in this way. Thank you very much.
Thank you very much, Barbados. I believe I have Guatemala next in order.
Thank you very much, and good morning. Lucrecia Landesmark, Minister of Health of Guatemala, for just barely 2 months. So these are my very first words at an event such as this one. Thank you very much, and as I said, good morning. Let me begin by congratulating the Ministry of Health of Panama and the people at the head table for this initiative to lead and coordinate. And Guatemala does agree and support the idea that the agenda of the Americas incorporate and be based on the 2030 agenda and the Sustainable Development Goals. It is worth mentioning that contrary to the MDGs, this new agenda has many new dimensions, both in the area of health and other. It goes beyond poverty and to inequality. So the discussion of the agenda for the Americas, I'm sure, will be very fruitful, complex also, because we see that it's got far more substance, even for the discussion and the contributions that may be provided. As a country, for us, Guatemala, our concern would be, as we talk about the targets and the indicators, because when the discussion becomes regional, very frequently one hides national problems, and this is particularly true in the case of Guatemala. For us, it was very difficult to reach the MDGs, and in most cases we were unable to attain them. We even had some slipping back in recent years. And when looking at the MDGs regionally, it would seem that in general things did move forward, whereas in truth some countries actually slipped back. So that is something we need to take into account. There are some countries that have problems specific to those countries, that we make our best effort, but nonetheless we need a kind of plus in whatever work we undertake. The fact that we are working on a regional basis is a little bit of an encouragement, or it sort of spurs us forward to try and meet the level of other countries. Guatemala is very interested and we're keen in participating in the group, in particular to talk about some aspects such as cultural pertinence.
Barbuda, please.
Thank you. I want to thank the organization, and good morning, sorry. I want to thank PAHO and the Ministry of Health of Panama for convening this session. It's very timely since we're coming to the end of the Health Agenda for the Americas in 2017, and we're preparing for the Sustainable Development Goals. Antigua and Barbuda was pleased to be, and Dr. Etienne, we were involved in the development of the agenda for 2008 to 2017 during the period 2006 and 2007, and we were very happy to serve in that capacity. It was a learning experience for me, and it was a lot of work. But I think the outcome was a very good document that has guided us in the region towards this point. I think over the last few years we've realized that we really need to come together more closely and work together and really frame how we can move towards achieving the Sustainable Development Goals. Antigua and Barbuda, we would be very happy to serve again as part of the working group for the development of the new health agenda for the Americas. Thank you.
Okay, thank you very much. Jamaica, please.
Good morning and thank you. Jamaica is pleased to be a part of this process. We have gone leaps and bounds into really looking at the Sustainable Development Goals as a developing country. We started out by developing a multi-sectorial working group which consists of civil society, private sector, government and non-government organization, and the international development partners. We're working very closely with UNDP in helping us to really create and nationalize the Sustainable Development Goals. We have gone through the process of developing a national outcome document through several consultations with our national stakeholders, and we have aligned the Sustainable Development Goal with our National Development Plan, or Vision 2030 National Development Plan. So that alignment is made, and we were approached by some other international agencies to really show how the alignment was done. Jamaica is in the process of putting together our Health in the Americas report, and we are very interested in looking and working with the working group in aligning this health agenda now with our current national development plan. We are quite aware that there are several indicators that will need to be measured under the SDGs, and we do not want a duplication of measurement with our other international commitment that we have. So we are very interested in aligning now if we're going to develop an agenda for the Americas, to align it with our Vision 2030 plan so that we can just have all the indicators being monitored and one number being given across the board. We are aware that there are weaknesses going forward under the SDGs, and this was a discussion in our preparation meeting for this directing council as to how and what resources we will have to actually reach for in helping us to monitor the indicators over the period. Our National Health Information System that was highly spoken about by our minister this week is very important in getting data to move forward to measure all these different agendas that are coming together. We really want to maintain the gains that we have made under the MDGs. We know we had problems with maternal mortality and reducing our infant mortality rates, and we're very interested in making sure that we really improve on this throughout this period. And also the issue of universal health coverage that we're working very carefully on, noting that the indicators have somehow been weakened, some removed for universal health coverage, but we really want to make a strong case in moving forward on that in Jamaica to increase access and efficiency and really look at the quality of care that we're giving with the scarce resources that we have. So we're very excited about working with the working group, and we hope to lend some of the experiences we have had also nationally with the alignment of our vision, our national development plan, and working together. We are now embarking on a roadmap that is being funded by UNDP to help us kind of carve our way forward to 2030. So we're excited, and we're hoping that we will be included in the process. Thank you.
Thank you very much. Jamaica. Chile, please.
Good morning. First, I'd like to express congratulations for this proposal, which is highly relevant, especially in a country such as Chile, where equity is the basis of our work, and we think that it's key for Latin America. We agree and welcome the initiative, but I do have some questions nonetheless. My first one, which are the lessons learned from the health agenda of for the Americas? What happened? What's the outcome of the Secretariat? Not about the evaluation of because that we've heard about, but how it was used or put to use. My second question, given that this sustainable health agenda will have a comprehensive view, we'd like to understand what's the role of other agencies, because to think that we, from our ministries or through PAHO, if we're really going to have an impact on the region, we at least need the support from the social protection ministries or social health ministries. So that's also going to have an impact. So I'd like to understand what kind of role those other agencies will have and how they'll work with us. Third is actually a point of concern, not a question. In my country, at the highest level, at the Foreign Ministry, International Relations, there's a group of all ministers working on the national agenda. This means that we're going to have our national agenda by December of this year with indicators and goals, etc. So I just am concerned that we might be mismatched with what other countries are building, and we think it would be better if times were shorter so that we could really incorporate them in national plans. And obviously Chile does volunteer to be part of the working group. It would be an honor for us.
Uruguay, please.
Good morning to everyone, and thank you very much for the report. As we listen to representatives from Panama and read the material that has been circulated, we can understand the major complexity of what we are proposing to do. The world is increasingly complex, likewise the regional reality. And what is put before us today is extremely ambitious. This is a very long list of topics, in most cases with an intersectoral vision. So this is a political challenge. To put and to work on a proposal such as this one, especially when ministers of health, for the most part, are executives. And when we get involved in something, we have the responsibility to achieve results. There is one substantive aspect, and that is to perhaps identify some priorities that ought to be compatible with the national agendas. And I would imagine that there are different levels of development. In Uruguay, for instance, we work 1 year defining our national goals, and we involve academia, the health sector, the actors linked to trade unions and other associations. So this is a collective effort through which we're able to develop a roadmap in order to develop our priorities. And I would imagine that other countries have a similar process, and they have already perhaps developed the national agenda or are working on it. So there is also an issue about form. It's not just a matter of substance. And it's important, in order to bring together the political will, to give this initiative a possibility to attain the results that we all hope for. I think it's also important that we all have information as to the exact status of each country in regards to their own national process for goal setting. We also need to understand the potential and viability of information systems, because when we try to identify goals, the information systems then become extremely important. I think that what we're looking at this morning, and that is preceded by a very interesting report presented by Panama, it really involves a major challenge that, as the Director General clearly pointed out, expresses a desire and political will to take on this challenge and to set viable targets and goals, things that we believe are possible and attainable. And this is to be done in the framework of an agreement that has to take into account the different realities in the region, and they are very varied. So let me also say I would like to be part of the working group like others.
I could ask Canada to intervene, please.
Thank you, and good morning, everyone. And I'd like to thank Panama for convening this meeting, and we certainly appreciate the opportunity to discuss the health agenda of the Americas and the way forward in the context that we have with the new Sustainable Development Goals. The link with the Sustainable Development Goals, I think, is extremely important. We've all spent a lot of time developing the SDGs and coming up with, and still are in the process of coming up with the indicators under the SDGs and for health and all the health-related goals. I think in this, at this stage, the context of developing a new health in the Americas, or health agenda of the Americas, is quite different than what it was when this was first developed. Even the process here within PAHO in developing the strategic plan has changed very much. We've done a bottom-up approach. There have been national consultations where each country's identified what its priorities are. And that was quite an intensive process on all of our sides. And we had also good discussion earlier this week on the stratification process of how we determine our priorities. So we've got so many different tools and mechanisms that are available right now. And what I think would be really important is to make sure that we don't duplicate any of that, that we align it very well, and that we have a product that's actually very useful. So speaking to our previous colleagues' point that you know, we need to make sure that it's the form is just as important as the substance in this case, to make sure that it's a product that really works for us. So the other thing that I just wanted to mention was that the reporting implications of the health agenda. We were also very much engaged in the development of the first one, and we're very engaged in the midterm evaluation. And even for Canada, that was a significant reporting burden. So it would be good to use whatever indicators that we already have, that we're not burdening ourselves with something where we're coming up with a whole different set of indicators, or one set of indicators would be really good, I think, for all of us. I see a lot of heads nodding, because it really is such a significant burden in the end for us, and I don't think that's really what the purpose of this would be from what I've heard from the presentation, that it's really something where we build political commitment, build the relationships, and really look at it from that perspective. And just to end that, a lot of our priorities would be very similar to what others have raised, in particular issues around vulnerable populations, indigenous populations. We would also be interested in working more on AMR and on obesity. We've got some good work already going on in the region in those areas. So thank you very much. Thank you for this opportunity.
Thank you very much, Canada. I would just note before calling on the next country that we have arrived at 8:30, which was the expected end to the meeting. We certainly can continue until shortly before the plenary, but obviously if people need to leave, then we would certainly understand. Suriname, please.
Good morning to you all. Well, I'm still trying to understand how this agenda setting and implementing works. I'm trying to envision, of course, the other countries like Suriname are also member of other sub-regional organizations with their own agenda. But I do see that it is worth to put the effort in. So I would like also to know how did the current agenda, how does it work? And I want to recommend that for the process we take into consideration the roadmap for implementation of health and health policies in the Americas, and also the results of the work of the Marmot Commission on the review of equity and health inequalities in the Americas. Thank you.
Thank you very much, Suriname. Ecuador, please.
Thank you. And I'd like to thank Panama for having convened this meeting. We find this meeting very helpful because it means that this new continent always has dreams and believes in utopia. And we just need to get together, and the very fact that we're sitting here dreaming about what we can accomplish is very significant. We'd like to, therefore, participate in this new challenge. And I'm very happy because, as our colleagues have said, we find that we always need both a political and a strategic framework in order to continue the work of our various agencies and our parliaments. And so I think this is both a political and strategic challenge. And it will help us provide guidance to government and NGO entities as we work towards analyzing what our needs are in each country. I see, as my colleague said, that this is a collective action, and it's also participatory, because very often we look at things from a bureaucratic approach, and we allow, when we hear whatever civil society wants to say, but we may not necessarily follow through. Whereas I believe that here, this is an opportunity for us to really hear those people who want to and should be involved, such as the Minister of Uruguay has said, academic circles and other social entities. I also see that these are binational agreements, and in the last 10 months, as I've held the state portfolio, sometimes I find things are not clear. As countries, each of us must make our own effort to reach more equitable and fair goals, and I think this is an example of one that we could follow and would be effective, because it would help us develop a strong agenda. Another issue that I believe is very important is mental health. I'd like to reiterate what the U.S. said. There are more deaths caused by drug dependency than caused by auto accidents, and I don't want this to happen to our countries as well. So each of us has examples of successful efforts, and we could join efforts with others to use these to attain our own goals and establish indicators. Ecuador is fully willing and interested in participating as a full-fledged member of this new challenge during this new time and moment of the Americas.
Okay, please.
Muchas gracias, muy buenos días.
Thank you. Good morning. I fully agree, as other colleagues have said, from Chile and Uruguay, and so I won't speak at length, but I just wanted to say that for Paraguay, it'd be an honor to work on the sustainable agenda.
Puerto Rico, please.
Buenos días.
Good morning. I'd like to congratulate Panama for having resumed this initiative that they started some years ago. We see this as an example of a strong commitment that our countries have made through their ministries to try to achieve better health for their peoples through the SDGs. Also, the strong support that Dr. Etienne has given to this initiative from the technical perspective, as she clearly explained, is another example of how democratic this continent and this organization is, and how we have a very comprehensive vision about the importance of health. We need to see health as an investment that will lead to social and economic development. In her presentation, she said that implementation means we have to clarify the goals and the targets and adapt them to each country's context and adopt them within the region on the basis of consensus. I think that's a very important point because it has laid the groundwork for this very important project. I also joined the Minister of Health of Guatemala in what she said, and as she was supported later on by Uruguay and Chile, in saying that it's very important that this be adapted to the reality of our countries. And as Canada said, we also must make sure that we are not duplicating the efforts of others, because I think this is an excellent initiative. And in conclusion, I'd like to make a comment to Panama. Puerto Rico has a long tradition of relationship with your peoples, and we therefore would love to congratulate you once again for this initiative.
No, please.
Argentina is in agreement with the proposal and intends to work very actively in this area. We think it's an opportunity to have a dialogue, to reach consensus, but mainly to establish strategic partnerships. And unlike other groups in which we've been working, as the SDGs and others, we see this more as adding, as the vision of a port. As a philosopher said, there's no captain whose winds may be good if he doesn't know what his port will be. So we have to have a vision of what our port, what our objective is, in order to develop a strategic partnerships. So we are ready and willing to work on this.
And I believe the last country requesting the floor is Honduras.
Buenos días a todos.
Good morning. The 2030 agenda is a very ambitious one, it's true, but it's something that all of us are working towards, particularly the developing countries. Eradication of poverty, in fact, including extreme poverty, is a strong goal for us, and we have significant challenges in this area, and this presents a particular challenge for our organization because we're a multi-ethnic society and our people live in a very vulnerable environment. But my country's political will is very strong, and in the last 3 years of government we've seen that steps have been taken already to improve the standards of living of our population. But there's still a lot to be done, and as we look at this agenda, we want to eradicate poverty, and not only in the area of health, but we need to work in other sectors as well. Our effort has to be intersectoral. For instance, in Honduras, the Secretariat for Development and Social Inclusion is the one that has been participating in this working group. So the challenge here is, what kind of support will we receive, what kind of technical support will we receive to be able to participate and participate effectively so that we can target health. How can we make sure that we have strong leadership in that area? And how can we strengthen it? Because sometimes things fall to the back burner. This is a strong, the development of the health of the people is a very important component of this agenda, but it has to be adapted to the needs and priorities of each country. Honduras, therefore, would like to join you in this challenge. We are pleased with it, and please count on our support and ensure that we will be 100% involved on this issue. Thank you.
Any further requests for interventions at this time? I did hear at least one member state asking about the lessons learned from the previous, or if you will, current health agenda. There was a significant exercise that was done, I believe it was referred to, for the midterm assessment of that. I'll ask my colleague from the Planning and Budget section, Ronnie Massa, to give us a very brief summary of that before I will pass the floor back to Panama for comments. Okay. I'm sorry. Bolivia, please.
Kamisaki, Hilatanaka, Culiacanaka, hermanos y hermanas del mundo.
Sisters of the world, I think for the health of the world, it's extremely important to work together because there are no borders for all of us in the area of health. Medicine is important for all mankind, and what's most important is to save everyone's life and to work together to achieve that. I think we also need to protect the Pachamama, the Mother Earth, and protect our environment. Only in this way can we eliminate disease from the world. We are in agreement with all the countries that it is very important to work together with all our sister nations and to save humanity's life in this world. In our country, in the plurinational state of Bolivia, we also recognize the traditional medicine. We have Law 459 adopted under Statute 436. So we believe it's very important to make a lot of headway in traditional medicine. I think a lot of countries use plants and herbs. Our grandparents cured themselves using these plants and herbs as medicine. And so it's very important to work in that area to strengthen and help develop ancestral knowledge of our countries, take into account the traditional medicine. In my country, there's a lot of headway being done with traditional medicine. We're recovering the ancestral knowledge of our peoples. Our President Evo Morales is very familiar with traditional medicine, and that's why our brothers and sisters, the traditional physicians, are very happy. There are workshops always organized in Bolivia to train traditional doctors, and they want to move forward because in rural areas we don't have physicians. You have to travel 2 or 3 days to go see a allopathic doctor, and that's why we're helping to train the traditional doctors that are closer to the people. So we would like to see a hayaya for everybody and for all countries. Thank you.
Again, Senor Massa, if you would give us a very brief look at the experience with the previous agenda.
Thank you, Dean, and good morning to delegates. Good morning to all. Very briefly, I will switch to Spanish right away. Bueno, en la evaluación.
In the midterm review, where we look at the progress made in the agenda, it's important to underscore, and this is in direct response to Chile, that the agenda was conceived as a political strategic framework, and we reviewed more than half of the strategic plans and policies applied by the countries between 2007 and 2011. And we found that there were 2 subregions that used the agenda as their guiding compass to develop their own subregional agendas and plans. This occurred particularly in Central America and the Caribbean. The areas of action and the focus on the social health determinants and social protection were the beginning of a change, getting us all to work not only to deal with disease, but to improve health. That's the main change, that we need to deal with emerging issues, but we must go beyond that as well. Another important point that comes out of this assessment is that since didn't have any specific goals, and it's a political framework, so it doesn't need that, but we felt that there was a need to have specific goals to see how we could coordinate to be able to measure them. So even though there are no indicators, we felt that there should be very clear goals as to what we want to achieve so we could be able to measure where we are and how far we've come. So one of the recommendations was that we use the indicators that already exist in the strategic plan and in other national or regional documents. Another important point made is that we need to promote the agenda in order to ensure it is enforced or carried out. It had been used before, but not on a systematic basis. So in this new document, we asked the Secretariat of the Pan American Health Organization to play a more proactive role in implementing this agenda. It was suggested that the Secretariat try to promote the agenda and any opportunity that they had to promote the strategies. Under indicators, under this new process, we're looking at the opportunity to building on what already exists. For instance, on the proposal document that you have before you, it talks about the possibility of using the analysis being used for the health of the Americas that will be concluded next year. We're also talking about the possibility of using the indicators that appear in the strategic plan, as well as those that appear in the SDGs, and also the opportunity to incorporating those so that we don't duplicate efforts. Thank you.
Panama to comment and perhaps to wrap up the meeting given the time.
Sí, bueno, primero.
Again, thank you very much to all of you for your presence here today. I see the room is very full, which I think is a demonstration of the commitment that all of the ministers and delegations of each country have to improving our health systems in each of our countries. As many of you have said, in order to achieve the Sustainable Development Goals, we must work with other institutions and other ministries in each one of our countries in a coordinated fashion. Because if we don't attack the social determinants of health, we're not going to be able to attain these objectives. For instance, Honduras gave the example, I think Barbados gave another example, of the fact that they work together with the ministries of social development. In Panama, we have the Social Cabinet, which includes the Ministry of Education, Public Works, all of whom work together to ensure that these social determinants are attacked and addressed so that we can successfully attain the SDGs. And of course, the focus of all of this is a human being and primary care of the human being. I'd also like to thank all of you for saying that you would like to join the group. And so I'd like to ask Pan American Health Organization to send an email to each one of the representatives so that we can formalize the composition of the group, and then so that we can convene you for the first meeting and start working on the roadmap. Basically, the idea is to identify what are our regional priorities so that we can then work together to ensure that we have better health in our people.
Well, we'll go ahead and end the meeting now. Just a few notes in terms of follow-up. The Secretariat will indeed help to coordinate first meeting of the working group. I believe this meeting will be virtual, given the time frames that we're looking at, and then that working group can take a more detailed look at the steps forward as well as issues of leadership in terms of the working group itself. So if there are no further comments, thank you very much once again for your participation early this morning, and we'll see you in a few minutes in the plenary.